Living with type 1 diabetes is already a lot. Decisions, numbers, alarms, and the constant effort to stay one step ahead. But for so many people, there's also something else layered on top of all that. That's the judgment, assumptions, the feeling that if something's off, it must be your fault. And that experience actually has a name. It's called diabetes stigma. And it doesn't just affect how people are seen. It can also shape how they feel about themselves, how they show up in healthcare, and how they carry the day-to-day weight of diabetes. My name is Scott Johnson, and today I'm joined by Matthew Garza from diaTribe and dStigmatize. We're talking about what diabetes stigma really is, why it matters, and what it might take to start changing the story. Before we continue, I do need to remind you that we're not providing medical advice or endorsing any specific product brands. We'll always encourage you to consult your healthcare teams for personalized guidance. I'm excited to welcome Matthew Garza to the show today. Matthew is the director of dStigmatize at diaTribe, where he's been leading efforts to better understand and address diabetes stigma. Matthew, thank you so much for joining me today. I'm really looking forward to this conversation.
Yeah, of course. Thank you for having me, Scott. I'm excited to be here.
I'd love to start with a little bit more about you and your work. Can you tell us a little about your role at diaTribe and what led you to focus specifically on diabetes stigma?
Yeah, definitely. So like you said, I currently serve as the director of our dStigmatize program, which is focused on raising awareness around diabetes stigma and looking at efforts to address it. But before I started working in this role, I actually was the managing editor of diaTribe's educational resource and our newsletter, diaTribe Learn. So while I was there, I was helping to craft all of the different articles that many people might see that cover everything from the latest news in the diabetes field to recipes and personal stories. But at the same time that I was kind of running that area of diaTribe's work, we had this little side project going on that was trying to understand some of the bigger systematic problems in the diabetes field. And one of the areas that we really started to hone in on was this issue of diabetes stigma, because we saw that it was basically creating barriers to progress in a number of different areas, whether that was in innovations in tech and medications, or whether that was in research funding or maybe nutrition guidance. And as we started to kind of dig into what diabetes stigma was more and more, we realized that it was something that wasn't going away anytime soon. And we really needed more efforts, more collective efforts, addressing and focusing on diabetes stigma if we ever wanted to see the benefits of all of the other kind of really incredible innovations going on in the diabetes field. So what we decided to do at diaTribe is create a program around that. And back in 2022, I got the wonderful privilege of being able to help launch that program. And ever since then, I've had the joy of getting to work on this issue at diaTribe.
We could not ask for a better person to run those efforts. So I'm so thankful. For someone who maybe is hearing that phrase or term, diabetes stigma, for the first time, how do you define it in kind of everyday plain language?
It's funny. Diabetes stigma is everywhere. And as soon as you kind of start to notice it, you see just kind of how insidious it is, how deeply embedded it is in so many different areas. And the reason is because diabetes stigma is going to refer to any of those moments where people are being blamed, maybe they're experiencing shame, self-judgment, judgment from others. It might be hurtful comments or bullying. And whenever it is elevated to the level of discrimination, maybe a person with diabetes isn't able to do something or have access to something, that can lead to discrimination as well, diabetes discrimination. And so we see that diabetes stigma really shows up in a lot of different areas. And it's sometimes those feelings that you can't quite put a word to, but it's that idea that, did I cause this or am I at fault for this? And the reality, and the more that we learn about diabetes stigma, is that no, it is no one's fault that they got diabetes, even though our culture and some of the messages that we're exposed to seem to tell us that maybe it is.
What surprised you most about how maybe common or impactful stigma actually is?
Stigma is so deeply embedded into just our culture and the way that we think that it's hard to sometimes disentangle it. And I think that was what was so shocking. It was, this idea that maybe when you're first exposed to a concept like diabetes stigma, you tend to think, oh, is this just, some mean jokes that somebody makes and we should just brush it off and move on with our lives? But it has a lot more impact than sometimes we think. And I use this example often, which was back in 2017. So a few years ago, there was the manager of, I think it was like the Office of Management and Budget in the US government. His name was Mick Mulvaney. And he made this comment that was essentially trying to justify healthcare spending and what we put spending on from the government perspective. And it said, we shouldn't be wasting our money on that person who sits on a couch, eats junk food, and gets diabetes. And when you think about someone who is at the top echelons of our government, who is making decisions on what we spend money on, what we spend healthcare spending on, research spending, what we're investing in when it comes to medicine and research and all of these things, someone who has that mindset about an entire population of people living with a chronic condition that was not their fault, you can just see how, this idea of diabetes stigma then impacts all of these major decisions that can affect millions of people. And I think that that's sometimes where we have to ground ourselves is it's not just a mean comment at a dinner table. It is how governments, how research institutions, how people who have power are making decisions about diabetes care long term.
That's a really striking example. I think when I think about diabetes stigma, I often think about examples of a bad joke on social media or maybe a misconception on a TV show or something like that. But that example that you shared is, I could see how that has huge impacts.
And it's not to negate any of the times that maybe a hurtful comment or a joke made someone feel uncomfortable, but I think it just goes to show that diabetes stigma isn't just that. It's so much bigger than that.
Yeah. As you've listened to many people living with diabetes, where do you see stigma showing up most often in their day-to-day lives?
Stigma shows up in a ton of different areas. I think one of the most common places that we see people talk about experiencing stigma is within the healthcare space. So maybe that is going to a doctor's appointment and feeling really judged by their physician. Maybe they, breeze over asking questions and they just jump right into, your numbers are bad. We have to get you to stop eating as much. Or, these glucose levels, your A1C is really awful this time. And what are you doing wrong? As soon as a doctor says that, or maybe it's even a support staff, it's a receptionist or a nurse that you're talking to. As soon as they kind of say something like that, and they don't take the time to really ask questions and get to know a person, it can feel really dismissive and make people want to disengage. Healthcare is by no means the only area where this shows up, though. And I want to give a lot of credit to the doctors, the nurses, and everyone who is doing really amazing work to not contribute to stigma. But we also see that diabetes stigma shows up in interpersonal conversations among friends, families, coworkers. We see it show up in the media and how diabetes is portrayed, which is often very inaccurate or really stigmatizing in the types of person that is supposed to look like they have diabetes. Yeah. And especially when we think about like discrimination and how diabetes stigma and discrimination are related, we really can sometimes see this in like work policies or education policies, where maybe a child isn't allowed to do something that other kids are able to do because they have diabetes. Or a person is asked, you need to inject insulin in a bathroom because we don't want you doing that during a meeting. Those sorts of things are, one, not okay and not allowed. And two, make people feel like diabetes is something they have to hide. And that's not anything that anyone should ever feel like they have to do.
We've talked a little bit about where stigma shows up in the world around people. I'd love to spend a few minutes talking about what that actually does to someone living with diabetes. When they're exposed to this kind of stigma over time, how does it start to affect the way that they maybe see themselves?
So the research on diabetes stigma is a growing field, and I have to give so much kudos to all of the amazing researchers around the world who have been really trying to better our understanding around what diabetes stigma looks like and how it's impacting people. The reality, though, is measuring stigma can be a bit tricky, and measuring its impacts can be a bit tricky. So I just want to preface all of what I'm about to say with the note that we can't be positive yet that experiencing stigma causes these effects.
Sure.
But what we can be sure of is seeing that these things are happening in tandem. They're happening at the same time. So we're able to at least see this association between stigma and a lot of these really negative mental, physical, and behavioral impacts. So a couple of things that I always draw attention to on the mental side, we see that it impacts people's self-efficacy, their ability to take care of their diabetes and manage it. We see it affects their self-esteem, their diabetes distress levels, whether or not they may be experiencing depression or anxiety or elevated stress. And it can really impact people's resilience, their ability to kind of, deal with the challenges of managing a chronic condition that demands so much of each individual who lives with it. But it's not just mental health that diabetes stigma is impacting. It can also impact people's physical health. So we see that when someone reports experiencing higher levels of stigma, they often have a higher A1C. Maybe they have a higher BMI or body weight. They may also have or be more likely at risk for certain complications. We've started to see that in some of the things like eye complications and DKA episodes and things like that as well. Right. And then finally, and I know that this will probably be something that we talk a little bit more about, but it can impact our health behaviors and the way that we move through the world. And so it's not just, the direct measurements, but it can be, what are we doing to take care of ourselves long term as well?
Yeah, that's great. I'd like to dig in on that point a little bit more. When I hear you talk about that last part, it makes me think that there's some connections to, with stigma connected to things like shame, guilt, or burnout that people with diabetes often talk about. Can you tell me a little more about that?
It's really interesting. One of the easiest ways that we kind of see this is how it impacts people within the healthcare space and how they interact with healthcare. So what we see is that if somebody, for example, goes to their doctor and they have a really negative or stigmatizing experience, the reality is that they're likely going to go home and feel like they don't want to go back to that doctor anymore.
Yeah.
And maybe they, decide to cancel their next appointment because they're scared of being judged. It might prevent them from getting screened for a certain complication because they're nervous that, it's going to be a result that I don't want. And then my doctor is just going to say that I didn't try hard enough. Yeah. And so we see how this can create this compounding effect. And the really sad part of that is that it creates a loop as well. So when someone maybe starts to disengage with the healthcare system, or maybe they're not doing as many of their self-management behaviors, that can often then reinforce the exact things that led to those experiences of shame and judgment. They might see their A1C or their numbers start to creep up. And then the doctor is just going to say all over again, what did you do? Why is this not right? What aren't you doing? And so I think that it's something that we really need to start breaking that cycle. And it goes to all of us. It's about building resilience. So that way you're not maybe as affected by stigmatizing experiences on the personal side. And it also means talking to these healthcare professionals or those individuals who are causing stigma and making sure that we nip that in the bud as soon as we can.
For someone who's listening and they're maybe realizing, boy, I've been carrying some of this around. What would you want them to understand about that experience?
I think the biggest thing and the thing that I want to drive home more than anything else is just that diabetes is not your fault. Nobody chooses to have diabetes. This is a really complicated and serious chronic condition that affects people of all different, body sizes, classes, races, where they come from. It's not something that, you can just make the easy analogy that you ate too much or you ate the wrong things and now this is what you deserve, whether that's type 1 diabetes, type 2 diabetes, or anything in between. And so I really just want to make sure that for the diabetes community, everyone understands that this isn't your fault. You are not to blame. And this is really hard. So celebrate those wins. Make sure that you know that, one misstep or one bad number does not define you as a person. And you're so much more than your diabetes. And I really hope that that is something that, we can start spreading even beyond the diabetes community. This goes to everyone who's experiencing chronic health conditions or health stigma in any form. And we really just got to break this idea that health is solely your personal responsibility, because there's so many factors that are outside of any of our control that impact our health outcomes.
Very well said. And we deserve to be able to take good care of ourselves. Yeah.
Absolutely.
All right. This is a great place to take a quick break. When we come back, I want to shift towards what we can actually do about this, because I think a lot of people listening are probably starting to wonder, okay, how do we start changing the conversation around diabetes in real life? Before we dive back in, I want to share one simple example of what taking action on this can look like. And to be clear, this is not an ad. There's no sponsorship here, just another great coalition working on this topic. Matthew's work with dStigmatize is part of a much larger global movement to end diabetes stigma. And one of the ways that movement is showing up right now is through the End Diabetes Stigma initiative. One of the easiest ways to get involved is by adding your name to the pledge. It takes less than a minute, and it's a way of saying, we are choosing more respectful, accurate, and compassionate language around diabetes. You can find it at enddiabetesstigma.org. Again, that's enddiabetesstigma.org. Just look for the Endorse as an Individual section. And as we get back to the episode, we're going to hear more about an exciting global summit that just happened and talk more about what ending diabetes stigma can look like in everyday life. Welcome back. We've been talking about what diabetes stigma is, where it shows up, and how it can affect people over time. For someone living with diabetes, what are maybe some of the small ways they can start pushing back against stigma in their own life?
I think there's a number of things that people who are living with diabetes may be experiencing some self-stigma, or maybe they've had stigmatizing experiences in their life, things that they can do. So the first thing that I would say, I have 3 ideas that I like to share here. The first one is finding those allies, whether that is other people in the diabetes community who just help you feel heard and seen and empowered. Maybe it's finding friends or a really great endocrinologist who has your back, who understands your experiences, and who makes you feel heard. Or maybe it's even just like finding something that makes you feel good, or sharing your diabetes experience with somebody else for the first time. When you find those allies, it helps it feel a lot less lonely and a lot less isolating, because the reality is you are not the only person who maybe is experiencing some of these feelings. The next thing I like to say is stand confident in your lived expertise. We hear this word lived experience all the time, how important it is for us to share our stories, how important it is to have those personal experiences. But I think sometimes we think about it as almost like soft expertise. It's not, what the doctors have. It's not research. It's not, medical school information. Sure. The reality is, though, is your diabetes and your body better than anyone else in the world. You have expertise in what your diabetes is. So know that, don't let yourself be dismissed easily whenever you have feelings, experiences, or you're noticing something that deserves to be heard. And then the last thing I like to say is something that is definitely borrowed from a lot of the advocacy movements, and especially the LGBTQ advocacy movement and HIV and AIDS, who also dealt with a lot of stigma and have had to work really hard against that. And it's this concept of coming out. So often people hide their chronic conditions, or especially something like diabetes, as a way to keep it private, not have to deal with unwanted comments or questions or things that can be really annoying. And the reality is, so many more people have diabetes than you know. So many more people know someone who has diabetes. And the more that we can create this kind of giant echo, this huge voice that is lifting the entire community up together, the better we're all going to be prepared to push back against stigma whenever it shows up. And so I just want to encourage people that when you feel safe and comfortable, share your story and what it's like living with diabetes. It's going to go a really long way in creating compassion and empathy in others as well.
Another thing that is tied closely with stigma and where stigma shows up a lot is through language. What are a few examples of small shifts in language that maybe can make a big difference?
Language is huge. I want to give a lot of credit to those advocates and researchers who have been talking about the concept of language matters for decades longer than even some of our concepts around diabetes stigma have been around. The language that we're using whenever we talk about diabetes or we talk to someone with diabetes can be really stigmatizing. It can be judgmental. It can cause us to think about diabetes in a way that we shame and blame people for having it. And I want to encourage us to really be a little bit more mindful about our language choices. So one of the things that I would say is important to remember is that language is always evolving. And so it's important to give yourself and others grace. And by doing that, it just makes it so that it feels a little less scary. You know, you don't have to worry that you're going to accidentally say the wrong word and then immediately, be canceled or something like that. The reality is like, oh, we're going to try our best. And so I want to talk about kind of a couple of ways of what this looks like. And a great example is there's a lot of language in the healthcare space around diabetes that uses words like control, adherence, compliance, things like, oh, their diabetes is way out of control, or my patient wasn't compliant with the medication recommendation I made. Whenever doctors especially use those types of terms, it can sometimes create this really off-balance power dynamic. The idea that the doctor is in charge, they're telling a person what to do, and if that person doesn't listen, well, then it's their fault what happens to them.
Yeah.
We all know that is not how diabetes actually works. This is a team effort. The person with diabetes has so much agency over their diabetes management, but they don't have complete control over it. And so what we want to do in these scenarios is encourage, maybe physicians or doctors to shift their language to something that is a little bit more team-based, maybe a little bit more compassionate and respectful, and just acknowledges that they're one part of the care team. So maybe that looks like saying something like describing the actual recommendation that was made. It wasn't the patient wasn't compliant. It was Jessica wasn't able to take her medication every day because she sometimes forgot on her way to taking her children to school at 7 a.m. in the morning.
Yeah.
It's a little bit wordier, but it describes the challenges that Jessica might be facing. It describes some of the barriers that are maybe preventing her from actually taking her medication. And it allows us an actual opportunity to hopefully shift to more positive behaviors in the future. And it also just is more respectful. It actually describes the problem going on without using judgmental language. So I know that was a little bit of a wordy answer, but it's a complicated subject, language.
Yeah.
And it's something that is not just easy word swap sometimes.
For friends, family members, even healthcare professionals who want to be more supportive, can we dig into a little bit more of what that actually sounds like in practice?
I recommend for everyone who is, a little bit new to this, maybe they want to be a little bit more mindful about the language that they're using. The best thing to do is to ask people for their language preferences. What do you want to be called? Some people identify as using the term diabetic. It brings them power. It describes their lived experience. It gives a lot more emphasis to something that is very much a part of their life.
Yeah.
Other people hate being called that word, and they might want to be called something like a person living with diabetes. They just want to be called their name, whatever that might be. When you ask someone at the start of a conversation, or maybe for a doctor at the start of a new intake appointment, it just levels the playing field a little bit. It shows them that you're thinking about this. And even if it's a little awkward, what it does is it just, it shakes off the nerves, and it helps them see that you're a person too, and you're just trying your best to be as respectful as possible. Some of the other things that I want to give as recommendations are language goes beyond just the words that we're saying. It's also our body languages, the faces that we're making. When someone tells you that they have diabetes, don't make a face of disgust or immediately jump into some sort of, rude comment about if they ate too much cake when they were little. Those sorts of body language triggers can sometimes be as impactful as the actual words that we're saying. Again, this is huge in the healthcare space. The last thing I'll mention here is that kind of point that I mentioned earlier, which is have grace for yourself and for others. It is okay to sometimes be wrong. I think it's important not to get defensive if someone maybe tries to call you in and gives you a different word choice, or maybe tries to correct you. And it also means that, what you thought worked at one point maybe doesn't work anymore. And that's okay, because language evolves, and we're all trying to do what we can to make the world a more empathetic and more respectful place for people with diabetes. And part of that means that we're going to continue to learn over time what best practices really look like.
Yeah, I love that. And it's also a good reminder that we are going to be wrong about things. We're going to make mistakes. But if we're comfortable having conversations with our loved ones about it, then it really helps us all evolve. All right,
Yeah,
that's very,
definitely.
very helpful. Now,
Mhm.
Matthew, you've been part of a larger movement to address diabetes stigma, including the recent global summit. I would love to hear a little more about that. Can you share more and
Yep.
maybe a couple of things that stood out to you and talk about what gives you hope right now that things can
Yeah.
actually change?
Absolutely. Oh, I'm so excited to talk about this. So, we recently had the pleasure for diaTribe and just myself getting to attend the inaugural Global Summit to End Diabetes Stigma. It was happening in Jaipur, India, right at the end of March. And we had over 200 delegates from 40
Wow.
different countries attend in person. Each one of them, many of them were speakers and presenters. Many of them had submitted abstract contributions, sharing their story, sharing initiatives that they're a part of in their regions, sharing ideas for the future and ways that we can raise awareness around and address diabetes stigma. So it was just this most incredible gathering. I want to give a lot of credit to the entire steering committee, led in part by Jane Spate and her team at Deakin University and the Australian Centre for Behavioural Research in Diabetes. They were not the only group that was a part of this, but they have led so many of these efforts over a very long time. And I also want to give a lot of credit to our main sponsor, Breakthrough T1D, who was able to help give us some of the funding to actually bring this opportunity
Amazing.
to life. On the ground, it was one of the coolest things that I've ever gotten to be a part of because we had all of these advocates and researchers and healthcare professionals, each from their own regions, their own cultural context, sharing stories about what diabetes stigma looks like in their world,
Yeah.
how that impacts the people that they care about or themselves, and also this idea that maybe some of the solutions that we think will work in one place are completely wrong for another place in the world. The one other thing that I will mention is just a note for all of the different diabetes organizations in the world, because there was one session that we were a part of that was around campaigns and communication. And I think sometimes we have this idea that, diabetes organizations, they're already doing so much, and these are the groups that we should look for, when we're trying to understand and learn ourselves. The reality is sometimes even diabetes organizations can get their messaging wrong sometimes. And it was really a very cool workshop that we got to be a part of where we were kind of trying to craft what communications or a campaign can look like whenever it is free from stigma. What is the best practices for how we talk about diabetes, how we raise awareness around the issue of diabetes without immediately jumping to fear-based messaging or judgmental language. So I really just encourage all of us who are in the diabetes sphere, who maybe sometimes think, oh, I'm not the problem, I'm not contributing to this, to just take a step back and realize that, hey, we can all be a little bit better. And what can we learn from the diabetes community and from our peers to help us to improve the work that we're doing as well?
It really reinforces what we talked about just a few minutes ago about the importance of asking questions, having open, honest conversations, and learning what life looks like for the person across the table. And I imagine it's very much amplified on a global scale, but also in the world we walk in every day, where we're encountering different micro communities and micro environments of what someone's life with diabetes looks like.
Yeah. And you had mentioned, what is really giving me hope and what I'm taking away from this. And I just wanted to really call attention to the number of young adults and young advocates who are all who came from around the world to this global summit and shared their stories. I think more than anything, that just it really warmed my heart. It brought me to tears multiple times throughout the weekend of the summit. Just hearing the resilience of all of these individuals, the work that they're doing to uplift themselves, their families, their friends and peers in their own countries, and just how passionate they are about this issue. It made me think that, we are in very good hands with this next generation in terms of continuing to try to dismantle diabetes stigma. And I'm very excited because more and more over the next few weeks of our insights and learnings from the summit are going to become available more widely to the general audience.
Yeah, amazing. I know that at the time of recording, you're hot off the heels of the global summit. Do you know already where people can tune in to learn more? Where should they watch for some of that information?
The first is at enddiabetesstigma.org, spelled exactly how it sounds, enddiabetesstigma.org. Tons of the contributions, the learnings, videos from the summit are going to be posted there. And then for those friends who happen to be on LinkedIn, we also have an End Diabetes Stigma group on LinkedIn. So if you go to LinkedIn, type in End Diabetes Stigma, it should bring you to that webpage, and you'll get to see tons of pictures, insights, debriefs from the Global Summit. And we'll be sure to be posting more videos and learnings there as well over the next few weeks.
And you mentioned enddiabetesstigma.org, but there's also a lot of resources available just on the stigma topic in general at dStigmatize, right? Can you share a little bit about that?
Yes, we have a ton of resources on dStigmatize.org. So that is spelled dStigmatize.org. We will be sharing more of kind of our perspective on the Global Summit there. But already we have a ton of resources for healthcare professionals that have been published over the last few years as we've been doing this work. We have learnings for individuals living with diabetes to just better understand what stigma is and what it looks like. And at dStigmatize.org, you can find one of our newest initiatives that we've launched at dStigmatize, which is our Spoonful of Laughter initiative. So this is primarily a social media campaign, but it includes videos, comics, posts on Instagram and on LinkedIn and on Facebook that try to use this concept of comedy for social change. This idea that maybe we can talk about diabetes stigma in a way that isn't just lecturing people, but inviting them to laugh and giggle and be entertained with a hilarious sketch video or maybe a stand-up comedy set, but still learn something, still learn what diabetes looks like, maybe some of the silly stigmatizing comments that people experience. And hopefully it might lower people's guard a little bit and just allow them to see, oh, there's a different way that we can be talking about diabetes that isn't just negative and isn't just sensationalist, but is actually very much in the same language that we all speak in our day-to-day lives. So yeah, you can visit dStigmatize.org and see all of those different initiatives there.
Yeah, absolutely. And we'll get all of the links in the show notes so that we can get people to the right places. Absolutely. Perfect. Well, Matthew, thank you for talking with me today. I really, really appreciate it. It goes a long way in helping break down some of these stigmatizing things that we're experiencing.
Absolutely. Thank you so much for having me, Scott. It was an honor to be here.
Thanks for listening today. One thing that really stood out to me in this conversation is how powerful simple questions can be, especially around the language that we use to talk about living with diabetes, both with others and with ourselves. If you want to learn more about this work or explore resources around diabetes stigma, visit enddiabetesstigma.org as well as dStigmatize.org. And be sure to tune in for our next episode. Until then, keep living well with T1D.